The current Ebola crisis in West Africa has been very challenging and very difficult. It has been going on for the past 5 to 6 months now in the region, and the rest of the world picked it up in the past month or so. But for us West Africans, since February, we've been enduring stories about sudden deaths as a result of a mysterious illness or some cultural superstitious disease. There's a general sense of fear, a general sense of caution. It's been really hectic. It's been very difficult for us as West Africans. What Ebola has done is to expose the severe governance challenges that exist within all facets of our society. Many of the health systems have crumbled and collapsed in the midst of the epidemic. So Ebola has raised and drawn our attention to the fact that there's a need for us to do a lot more in terms of the health sector. All throughout West Africa, you've seen civil society step up. When government institutions have crumbled or have not been able to address the crisis, civil society groups are now taking the lead to ensure that the message gets to the people. So we've been leading public education efforts in Liberia, Sierra Leone, Guinea, and recently in Nigeria to educate people as to how to prevent the disease, because it's a disease that could be easily preventable if the right steps are taken. A lot of the challenges at the local level, if we can address the challenge at the local level and better manage and govern the little resources that we have, that can make a huge difference, which could easily be supplemented by international efforts. Part of what we've done is to call on our government to take a very serious look at public health service delivery in our respective countries. There's a lot that can be done in terms of rebuilding the public health system, improving the management and the coordination of these systems. It's not always about resources. So it's about better management of the little resources that you have. And if we manage those resources better, we think that we can make a significant difference in some of the negative statistics, and we can prevent Ebola from reoccurring again in the sub-region. Africa is slowly getting there. What the crisis, the epidemic has done, it will provide an opportunity for more people to come back. I think you will see a number of Africans, an increased number of Africans beginning to come back to the continent and beginning to make a huge difference in public service delivery and governance of the continent as a whole. One of the things that constantly gives me hope is the resilience of the ordinary African man, the ordinary African woman. They are of a very strong character. In Liberia, Sierra Leone, they've overcome conflicts. They've overcome long wars. In Nigeria as well, they've overcome very major conflict situations. So I have no doubts that we're going to overcome it. I think it's just a matter of time, and I think we need to change cultural practices and address some of the governance challenges. But definitely, it may not be in a year, it may not be in 2 years, but these are challenges that will be overcome.